The Marty and Laura Show is brought to you by Veterinary Village. With locations throughout Wisconsin, Veterinary Village is dedicated to enhancing the quality of animal and human lives today and into the future. Welcome, you guys. Welcome to the Marty and Laura Show. Marty and I are so excited that you're here to join us. We have another great topic for you guys tonight. We're talking, well, I don't know that it's great. I think maybe it's kind of a hard topic, but I think it's an important one. And we're going to talk about diabetes in our pets. And certainly diabetes affects people. It's a national, in the United States, a national problem.
Health crisis.
Health crisis. Yep. And I know it is an issue in our pets as well. Dogs and cats, yes?
Yes.
So, talk to us about when things go wrong in the pancreas.
Yes. So, you need your pancreas. Your pancreas has two cell types. It has the kind that produces the enzymes that digest your food. And without those, that is called exocrine pancreatic insufficiency, EPI. And I don't know about you, but on my radio station, I hear commercials
Ads
for
the
people with
medication
EPI.
for EPI.
Yeah, great for EPI. So exocrine pancreatic insufficiency means you don't digest your food adequately, and then it passes through undigested, and the dogs will have pretty severe diarrhea. That's a whole different thing than the diabetes. The other part of the pancreas produces the endocrine part of the pancreas produces insulin, which is essential for keeping your blood glucose level here instead of here when you eat and drink and then fast and then eat and drink and fast again. So your glucose should stay pretty steady if you have the right kind of functioning pancreas. Now, cats, we see males and females develop diabetes. Dogs are a little different. Mostly it's female dogs, and oftentimes it's schnauzers, and it's often associated with pancreatitis. So dogs that develop multiple episodes of pancreatitis, which is inflammation of the pancreas, they will oftentimes then become diabetic because there's so much scarring of the pancreas from the pancreatitis, they become diabetic.
Ow.
See, I got you again.
Totally got me. Like, I think we've even done pancreatitis, and I don't remember hearing this one. Okay. Maybe it just leaked out of my brain because, that happens to me a lot.
That does happen.
So so people have type 1 and type 2 diabetes, right? One is an autoimmune disease, and one is because you ate too many donuts.
Well, then I would qualify.
Well, so what do dogs have?
Only type 1 diabetes in dogs and cats. Okay. They all have what until recently was insulin-dependent diabetes. We didn't have any type 2, and we still don't, but we have a different treatment now for cats that's kind of interesting that we don't have for dogs. So all dogs that are diabetic are going to come in typically, and when they become diabetic, they don't sort of slowly have their glucose go up. They go from 100 to 400 like overnight. And they come in drinking buckets, urinating buckets, losing weight. If they're ketotic, they're vomiting, they're not feeling good. These dogs get sick and these cats get sick overnight. So doing an annual glucose level on them is not really all that helpful. Now, that doesn't mean we shouldn't do annual blood work because we need to check their kidneys and their thyroid and all the other electrolytes and all the other stuff. But you're going to prevent diabetes in a cat by knowing 3 months earlier that the cat's glucose was up. That's the other kind of interesting thing about cats is dogs, when they come into the vet clinic, their glucose level should be 100, 120. If they're a little stressed, maybe a little higher. Cats that are stressed, their glucose can often be 200 to 250, and that's simply from stress. And as soon as they go home and they relax and everything goes back to normal, we would retest the cat and they would be normal. And that's the tricky part, is that almost all cats, when they come to the vet clinic, are stressed. Mm-hmm. And so we have to interpret glucose levels on that basis. But if you combine a glucose that's high of 200 with is there glucose in the urine? Are there ketones in the urine?
Mm.
That's going to be the defining factor of whether they're truly diabetic or if they were just like, bah, I'm at the vet. I can't handle it. I'm
And
freaking
that makes
out.
their blood sugar wig out. That is crazy.
It sure does. And it wigs out really fast. And it's really unpleasant for cats to be at the vet clinic that are unhappy. It's unpleasant for the cat. It's unpleasant for the owner. It's
Mm,
unpleasant for the vet. It's
mm,
unpleasant for the vet tech. Nobody likes a freaking out cat. So if you have a cat that's likely to have some stress levels when they get put in the carrier, get put in the car, and get put in the vet clinic, then ask your vet in advance of the appointment, can you please send me some gabapentin? And I can give this to my cat the night before the appointment, the morning of the appointment, and then the cat's not going to be like a throw rug, but it's going to be a whole lot more chill than if they come in.
I need some kitty downers,
Yes,
dude.
they're spread eagled across the carrier, like I'm not coming out and you can't make me, and
And
there's
we
no
have
way
to
I'm going to
go
let
in
you
with
touch me.
welding gloves. Yeah. Hmm.
Yeah, we try not to do that. It's really stressful to the cat to see welding gloves coming at them.
Well,
So we try to avoid that.
just saying.
It's called fear free. I'm just telling
Yes,
you. We try
I
to
know.
avoid it.
I know. I know.
So we have to interpret lab work on cats a little bit differently than we do on dogs. But all dogs and all cats have type 1 diabetes, which means that if you have a dog that's diabetic, they're going on insulin or you're not going to be able to keep them going. So you have to make a hard decision in a day or two, not you can't wait a couple of weeks to make this decision. If your dog has high glucose and they're diabetic, you need to decide sooner rather than later. Yes, I'm willing to give insulin injections. Yes, it only comes as an injectable form. Yes, you will have to give 2 injections a day. And yes, there will be ongoing expenses for monitoring the dog and keeping them on insulin. You have to buy the syringes, you have to buy the insulin, and that's just life.
Yeah.
Now, I can teach almost anybody to give an injection, even if they think they can't. I've taught priests to do injections. I've taught secretaries to do injections. These are non-medical people. The priest stuck himself in the finger the first time we did it. I'm like, oh man, like how did you even do that? The needle is this big and you still managed to get it into your finger.
But you're
Great.
not even trying to
So,
do sub Q, right? You're just like
oh, it's
poking.
just sub Q. It's just sub Q, yeah.
Uh,
And most of the time we want to do it when the cat or the dog is eating for 2 reasons. One is we want to make sure that they're eating before you give the insulin, because if they're not eating and you give insulin, their glucose drops too low, that's bad. And secondly, you can give them something to do to distract them while you're giving the injection. And the needle is itty bitty teeny weeny. It's not hard to use. It's easy to administer. And they're, although they make veterinary specific insulin called Vetsulin, it's a little expensive and there are less expensive insulin choices on the market. But there's regular insulin, there's NPH insulin, there's all kinds of different insulins. So
oh my
when
gosh.
you get your insulin, you have to make sure you get the exact one, and you have to make sure your syringe matches your insulin. There's U40 and U100. So U40 means there's 40 units of insulin, and U100 means there's 100 units of insulin in a cc. So you can't use a U40 syringe with a U100 insulin or vice versa. So whatever your label on your insulin says, your label on your syringes has to match, or you're in trouble. So that's kind of basic. And I will tell you that
Okay, now this is my
Walmart,
face that you're
I
seeing.
know. And Walmart makes a very affordable kind of insulin that if your veterinarian says you have to buy Vetsulin, be aware that you can push a little bit and say, could I please use Relion from Walmart because it is way less expensive. So we have an alternative for those pets that if cost is your issue with treating your pet for diabetes, you can talk to your veterinary clinic about, is there an option that I can use has a less expensive insulin. So I'm not sure exactly who subsidizes the insulin, if it's subsidized or exactly why Relion is less expensive. Walgreens doesn't have it, Walmart does. I'm not trying to bash
And
anybody. I'm
and
just
this
telling you.
is this is my sheer ignorance, but I'm gonna assume that people insulin and pet insulin are different.
They're not.
What?
They all come from pigs.
Okay.
Porcine insulin, that's the source of our insulin, comes
Right.
from pigs' pancreases at the slaughter plant. So thank you, pigs, for giving up your life for bacon and for insulin. And maybe occasionally a heart valve. Just
Right.
saying.
Yeah.
Or maybe a kidney. I don't know.
Yeah.
So we have those choices for what we can do. So if cost is the issue, then talk to your veterinarian. If your issue is, I don't think I can put a needle in my dog or my cat, suck it up and learn to do the injections. Have your vet tech teach you if you have to go in twice a day for a week to learn how to draw the insulin into the syringe and how to give the injection, suck it up, Buttercup, because it's a tiny needle, and even cats and dogs won't really notice after you do 2 or 3 injections. And what I usually do is I talk to the client twice a day. I'm going to call you in the morning. I'm going to call you in the afternoon. How you doing? Are you good? Okay, you got it. Oh, okay, good, good. I'm going to call you again tomorrow. So you just want to give a little bit of support. Your vet tech, your vet, somebody can, your receptionist can call and just say, let me walk you through this and make sure that you're okay. Because it is a little scary the first time you handle a syringe. I remember the first injection I gave.
Sure.
It was almost 50 years ago, but I remember like, ah. But as soon as you've done 2 or 3 of them, you're like, oh, this isn't so bad. I can do this. And the dog is eating and they're having their little snack and you give the injection and they don't really notice and everything's okay. So I'm just going to say cost and being available twice a day for an injection is difficult, but the injections should not be enough to put you off. Now, cats, on the other hand, we have 2 oral medications that have come to market in the last couple of years for cats with diabetes. And this is like a huge breakthrough because it only has to be given once a day. There's an oral tablet called Bexacat. It's a teeny little tablet. And then there's Sinvelgo, which is a liquid. And both of them are given once a day.
Nice.
They don't change the insulin level, but they cause the cat to excrete more glucose out in their urine. So essentially their glucose level comes down because it's coming out in the urine. It's not staying in their circulation.
Oh,
So
interesting.
it's a very cool approach. And I don't know if anybody's looking at it for dogs. I don't know if it would work in dogs. I don't do
For
veterinary
people, I
research.
mean, you know.
I know, I don't know. I mean, I'm just a lowly practitioner that has to walk into the exam room and say, hello, your cat has diabetes, and these are our choices, and that's what we're going to do. And when we have a cat that's on these medications, we have them come in and we check ketone levels, not glucose levels, to make sure that they're not ketotic because their
So
glucose is going to go
explain
down.
ketone and ketotic. Like, I don't even know what that
Okay.
is.
So ketotic is the condition of having ketones, and ketones happen if you are breaking down fat instead of glucose as your energy supply. So people that are diabetic, cats that are diabetic, dogs
So
that are
like the
diabetic,
keto diet.
yes, which you do on purpose to make yourself ketotic, but in diabetics, you don't do it on purpose. It's just what your body does. And so basically you have these high levels of ketones. And we were just actually talking about this today at my quarterly meeting with my doctors and my staff, is that if you're ketotic, you can actually, some people can smell the breath of a patient that's ketotic, and it smells to them like nail polish remover. Now, I cannot smell ketones. My husband, on the other hand, can. And it's like cilantro. Does it taste like soap or does it taste like cilantro?
Right.
It's not like you decide if you can smell ketones or not.
It
Either
just
you
is.
can or you can't. You're genetically programmed to do that. And he used to do dairy practice, and he could walk into a barn of 80 cows, walk in and look around and go, okay, there's a ketotic cow in here. Like he could smell it that clearly. He'd walk down the aisle in the barn and he'd be like, it's her. Well, if you asked me to do that, I'd still be in the barn because I wouldn't be able to tell you.
Smells like
I'd be
cow
walking
poopy to
around in
me. I
circles.
don't know.
Yeah, I don't know.
Ah,
So
oh my God.
ketones are what happens when you metabolize incorrectly because your glucose level is high and you're not diet. You can't. So then you're metabolizing fat, and that's why diabetic patients that come into the veterinary clinic that are acutely diabetic are losing weight really rapidly. And if they become ketotic to the point that they can't eat and they're vomiting, those patients are much, much more difficult to manage. They require hospitalization and fluids and injections of regular insulin, which is actually the name of it, regular insulin, not long-acting or NPH insulin. So if you think your dog or cat might be diabetic because they're drinking too much and urinating too much, don't diddle around for 3 weeks. Get in the car, call for an appointment, get in the car, make an appointment, get your dog or your cat to the vet for a urine and a blood test to find out if they're diabetic. Now, diabetes causes patients to drink more and urinate more than usual, but so does kidney failure, and so does Cushing's disease, and so does leptospirosis, and so do a whole bunch of other diseases. So just because your dog is drinking a lot, urinating a lot, your cat is losing weight, it doesn't mean they're diabetic, but it's a really important thing to distinguish early on because the earlier you diagnose and treat diabetes, the better the patient responds, the less expensive it is for you, and the happier everybody else is.
Doggett simplifies the puppy buying journey by connecting families with the perfect breed and responsible, health-verified breeders. They are the only breeder marketplace that verifies health clearances and responsible breeding practices. Through their personalized puppy matcher tool and matchmaker services, they educate and guide buyers every step of the way, ensuring a seamless process and a perfect match for their lifestyle. From initial breed consultation to introductions with top breeders, Doggett makes responsible puppy ownership easy and stress-free.
Okay, so people with diabetes have to have a specific diet. How about our pets?
They do. They do make a high protein, low carbohydrate diet for dogs and cats. So yes, those are metabolic diets, and yes, there are prescription diets that are made for those. They may be higher in fiber, they may be higher in protein, they're definitely lower in carbohydrates. And if your vet says this is what you should feed, then you should feed that diet, and you should not sneak anything off the table to them. And the general rule of thumb is you feed the same amount at the same time, twice a day, every day. If you're going to feed a snack, feed the same snack every day. You can't say, today I'm going to give you, because I'm home on the weekend and we're going to hang out on the couch and we're going to eat donuts together. If you're going to eat donuts with your dog every day, I mean, if you're going to feed him donuts every day, you have to feed it every day. And you have to do the same amount of exercise every day, because exercise drives glucose into the cells, and snacks will drive glucose out of the cells and make them more likely to have a high glucose. So whatever you do with a diabetic patient, exercise and food-wise, has to happen every single day. And if they are typically on the twice-a-day insulin, which most dogs need to get good control, they need to have insulin at 12-hour intervals. And I don't care if it's 6 in the morning and 6 at night, or noon and midnight, but it can't go one day 6 at night and the next day midnight. So whatever you do for your schedule has to be the same. And that's the hard part about managing a diabetic patient.
Sure.
Is some of us have schedules that we can really control, and some of us, like veterinarians, that we have insane schedules. It can be really hard to manage these patients. And I had for a while a diabetic dog. And Cushing's disease actually in dogs can predispose a dog to diabetes. I had a diabetic corgi that I picked up as a rescue dog. We managed him for a very long time with his diabetes. And we weren't really all that good at it, but he never developed cataracts. But almost every dog that is diabetic will develop cataracts. Almost every dog, no matter how careful you are. Cats, no, their cats are good, man. I can see in the dark, I'm good. But almost every diabetic dog, fairly early on in their disease, no matter how careful you are with insulin and with diet and with exercise and with all the stuff you need to do, almost every diabetic dog will develop cataracts, which is, and they're dense cataracts. Like they will lose their vision from it. So if you go into this knowing that that's going to happen, it's a lot easier on you than if you aren't expecting it. And some of the patients that we see that are diabetic, they already have cataracts. Like they have become diabetic and they have developed cataracts almost overnight. So it's a pretty good clue to your veterinarian that you didn't have cataracts and now you do. You probably are diabetic. But it's a little startling for owners to say, wait, what?
Yeah,
like
no,
3 days ago he could see?
Wow. Okay, so I want to backtrack for a minute because I want to make sure I'm understanding this correctly. Your dog can become diabetic as the result of too many episodes of pancreatitis.
Correct.
So one prevention to keep your dog from ever becoming diabetic is to never do the things that would give it pancreatitis.
That can help, but it doesn't always work.
Right.
Some dogs
I'm trying to get different. I'm like,
right.
Some dogs just get diabetic because some dogs
Yes.
are made diabetic because of all the instances of pancreatitis.
Right.
Do we know which one's which or why?
Well, I mean, a lot of pancreatitis in dogs is caused by a high-fat meal that they weren't supposed to get. So the dog got into the garbage can and ate the leftover ham from Easter, or whatever it is that the dog gets into that's a high-fat meal that precipitates pancreatitis. Sometimes it's on purpose, sometimes it's not. I had one family that came in many years ago and the dog was sick, and it was pancreatitis. And I said there was a father and a daughter sitting on the bench in the exam room. And I said, okay, well, has the dog had anything out of the ordinary to eat? And the dad says, oh, yeah, we're a catering company. And I gave the dog some of the scalloped potatoes and ham. And the daughter goes, oh, you did too? Well, you know, it was pretty obvious that the dog got way too much cheese, too much cream, and way too many, pieces of ham in this scalloped potatoes and ham
Yeah.
that, Wisconsin puts a lot of cheese in everything they do.
We love Wisconsin. Okay. So I guess my question is there some way to know if the dog's pancreatitis or repeated pancreatitis is what caused the diabetes, or if it was going to get diabetes anyway?
There's no way to know. I mean, schnauzers are definitely the poster child for this, both for pancreatitis and diabetes. Some dogs become diabetic with absolutely no history of pancreatitis, but there is an increased risk. And we do actually have a newer treatment now for pancreatitis as well. So that's kind of cool, but it's a bit expensive. It's called Panaquel, and it's kind of a cool treatment. But again, not every veterinary clinic stocks it. It's expensive. Does it shorten the time that they're in the hospital? Oh, yeah, if they end up in the hospital, it sure does. But again, the most important thing is just to be reasonable about what you feed your dog. Lock up the garbage can so the dog can't get into it. Don't leave a bag of potato chips on the coffee table. Don't leave a pizza on the coffee table where the dog can get to it. And keep your dog on an appropriate diet at an appropriate weight. If your veterinarian is willing to discuss nutrition with you, follow the guidelines that they give you. If they give you ideas of what you should and should not feed, how about you believe them? And don't just go off the rails and say, yeah, but, he really loves it when I feed him, nachos.
Well, and again, I think the understanding is, a dime size piece of nacho versus a platter size piece of nacho.
Well, for sure. And dogs, because of their body weight being so much smaller, a dog with heart disease with a tiny little, like one pretzel with enough salt on it for a normal dog would not be a problem. But a little dog with heart disease, if it weighs 4 pounds, that amount of sodium is a lot. The same with our fat or with our protein, with anything that we feed. Remember, your dog does not weigh anywhere near what you weigh. So be thoughtful about how much that means. If that means you've scooped all the ice cream out of the bowl and you just let the dog lick the very little bit that's left stuck to the sides of the bowl, that's not so terrible. But if you put a whole big old scoop in the bowl, you're going to be in trouble. And it's really interesting to me when I'm in the exam room and there's a couple, whatever the relationship is, father-daughter, mother-son, husband-wife, partners, whatever it happens to be. There's always the person who's really strict about the dog's diet, and then the other one
who's in trouble.
Yeah, because they're always pointing at I never feed anything off the table, but, and so there's always this shifting of the blame. And I usually say, okay, under whose chair does the dog sit during dinner? Because
That
that's
definitely
hands
tells you.
down.
Yeah.
Oh yeah. If it's the baby, it's a high chair. Well, you can't do much about the baby throwing Cheerios over the side, and Cheerios are low in fat. You're okay. But it's always the other party that's responsible. And so I will send home a report card with a client that says, your dog needs to lose weight. And I put it in big red letters. And I'm like, now you don't have to be the bad guy. When you go home, I'm going to email you this or print this off for you. And I'm going to hand this to you and say, okay, you are not the bad guy. You can blame me for putting the dog on a diet or the cat on a diet. So don't leave the bowl of, the milk that's left over after your cereal. Don't put it in the sink and then know the cat's going to get up there and lick it out. Just be honest with yourself. If you know the cat's going to do that, pour it down the drain, rinse out the bowl, put it in the dishwasher, be done with it, because it is not fair to our pets to set them up for health problems related to our inability to manage their diet. Dogs and cats probably eat a much healthier diet than you and I do because we feed them appropriately and we don't always control ourselves as well. I mean, I'm going to get done with this and have a big old bowl of pasta, right? Yeah.
What are you going to say? It's a thing. If I could just be as svelte as my dogs, my life would be complete.
Well, and they're gonna live a nice, healthy life because we've kept them fit
Yeah.
and because we've fed them
Yes.
appropriately.
Yeah.
And it's a lot easier to have that kind of self-control when you're feeding your pet. Well, not always.
You would think it would be anyway. My failings as a human are not reflected in my dog. How's that?
Yeah, I'm much more careful with my dog's diet than I am my
So
own.
much clearly. Can we see? I mean, this is just a thing. Okay, finally. So you've got to treat your dog if it becomes diabetic. It can become diabetic really quickly. It can lead to some challenging outcomes and long-term things. Prevention is avoid fatty foods, keep your dog healthy and fit. What else do we need to know about diabetes? Is there a
If you
genetic
suspect
component?
it,
Is there a
yeah,
genetic component?
there probably is. Like I said, schnauzers, anytime you can point to a breed and say
Sure.
this is the breed,
There's not
the
like a
poster child,
test for diabetes,
a
like a
DNA test,
genetic screening test.
not at this point. It's hard to know what 10 years from now is going to look like for
Sure.
DNA testing.
Sure.
But right now, no, other than to say if there's a breed predisposition, then there's a genetic component to it. And is the breed predisposition in schnauzers because they're more likely to have pancreatitis and therefore the scarring that leads to diabetes? That's probably the suspicion, but right now we don't really know. But there's definitely familial things in dogs and cats, just like there are in us.
Yeah.
So, we see families of cats in Wisconsin that have a blood clotting disorder. And it's not because these are people breeding their cats. There are just these populations of farm cats and barn cats that have this bleeding disorder. And we know it's more prevalent in Wisconsin. We don't know why, but when we send our samples to Cornell for the test, they're like, oh, yeah, you're from Wisconsin.
Oh, interesting.
I don't get it. But there's a familial component to a lot of things that we don't fully understand.
Right.
So at this point, we don't have DNA tests for some of these things, but be aware that if there's if you say it's more common in Newfoundlands, it's genetic. It's more common in Bernese Mountain Dogs, it's genetic.
Right.
I can't. You can tell me that it's not, but I'm going to tell you if there's a predisposition, it's genetic.
Yeah, there's got to be somewhere, somehow. Nobody's just found it yet.
For sure.
Okay. All right. Well, there you go, guys. Your primer on diabetes in your dogs and cats. And keep an eye on them. Keep them out of the naughty food. Save the naughty food all for yourself. That's what I'm saying.
Lock up the garbage. Lock up the garbage can.
What is
rinse it
that?
down the drain.
What is it? Save a horse, ride a cowboy. Save your pet. Eat the ice cream.
Oh, yeah, for sure.
Awesome. All right, Marty, thanks. You have a great night. We'll talk to you again next week.
Thanks.
Thank you for joining us on the Marty and Laura Show. We're excited to bring you these unique, fun, fact-based conversations about pet health. We hope you'll join us on social. Stop by the website to sign up for an extra tip of the week for your pet. While you're at it, do us a favor, please, and leave a review wherever you find your podcasts. The Marty and Laura Show is produced by Pure Dog Talk, Inc. Sound design and editing by Premium Audio Services.